Facing cancer can be overwhelming, but you won't have to face it alone. Our Nurse Navigator will work with you, guiding you on a path to health.
I think that we're very blessed here at Botsford Hospital at the Cancer Center because we have a very unique situation in which the surgeons, the medical oncologists, the radiologists, all the ancillary support staff are very closely knit together in terms of focusing on what the patient's needs are.
A cancer diagnosis is very stressful, and daily the team here at the center works very hard to ease that stress.
Certainly, whatever we can do to reduce the stress level that somebody's already going through because they've been told they have cancer is going to help them in the long run. Many of us also have had family members that have suffered from breast cancer. And so not only are we dedicated to helping other people, we've had to help our own family members.
One of my goals and my interest is in promoting timeliness in care, because having a diagnosis of breast disease or breast cancer is extremely stressful and overwhelming. We want to provide the family, along with the patient, with the resources that they need to help their patient, their loved one, through their journey and recovery.
My role here as a social worker is to meet the patients where they are. Every patient's going to have a different set of problems and a different set of needs and different layers of resources that have already been made available to them. My job is to see what's missing and to kind of puzzle it in for them. Emotional support, physical support, whatever is needed to help them through this time.
The fact that people at Botsford treated me like a person who just happened to be going through something really difficult made it easier to realize that I would feel like myself again at some point. I would feel like a normal person, and cancer was just something that was happening to me that I had to deal with, but it wasn't overtaking me.
I think it's critical that each patient is recognized as a person, not a bed number, not a room number, not a left breast. They have a family, they have a husband, wife, mother, and I believe when you recognize that and that's your starting point, all things down the road will be better by facilitating timely appointments for the patient throughout the system with their multiple providers, different clinics, and so on, so that they reach treatment and reach end of treatment in the fastest way possible.
My children decided at one point they needed to make a thank you card for Penny, who is the Nurse Navigator, and they call her Miss Penny. And they wanted to thank her for making sure that people were taking such good care of me here. And certainly, Penny has given us a lot of support through the whole thing. She was one of the first people to give me some words to use with my children to help them understand what was happening, what it might mean to our family, how things were going to change, and how they would be the same. And it really gave me confidence to be able to talk to my kids about what was happening.
And it's very meaningful to me when I get documents like this. I treasure them.
Each day, the Botsford Cancer Center team dedicates themselves to help you overcome cancer. Each day it begins with you, our patients, and how we can bring health and wellness to you.